Hi, it's Dr. Centeno, and today we're going to talk about front inside knee pain caused by loose ligaments. Now, you see down there the medical terminology for what this is, but we're going to keep it kind of non-medical as much as we can. So, the ACL ligament lives in the middle of the knee and prevents the tibia, the bottom bone, from moving forward. It also stabilizes the tibia in rotation, which is something a lot of providers really forget about. I see a lot of missed loose or lax ACLs because providers are only checking what's called a drawer test. And that's the case with this woman's ultrasound images that you're going to see. She had a normal drawer test, so when I pulled the tibia forward, it seemed fine. But when I rotated the tibia, it was unstable. And that ended up causing some serious issues in her. So the question here is, can a slightly loose ACL, not something that a surgeon would want to replace by any means, have dramatic impacts on the anterior medial meniscus, or the front inside meniscus? And I think, as you'll see, it really can. So I put an ultrasound probe on this patient in the inside front, or the anterior medial meniscus area. I imaged that meniscus, and then I rotated her good side and I rotated her bad side, meaning the side with pain. And I saw really huge differences just visually, but I was able to capture those on the ultrasound, which is kind of neat. So you can see here on the left, when I rotate the tibia, we're getting a little bit of motion of the tibia on the femur against that meniscus, but not dramatic. And then on the right, you can see this dramatic motion, much more motion occurring there as I rotate. In fact, I'm going faster on the right because it's so loose. So you can see that's beating up her meniscus on that side every single time she tries to take a step, because the tibia rotates when you take a step. Every single time she pivots, it's beating up that anterior medial meniscus. So again, a very important issue that was completely missed in this patient. So in conclusion, a loose ACL, not one that needs to be surgically replaced, but just one that's loose from an old injury, in this case, an old ski injury, can cause significant wear and tear in the front inside of the knee. And fixing the ACL via precise injections of orthobiologics is our solution. We've been doing that for many, many years, and we believe we can now help her by stabilizing that ACL, again, without surgery, but through precise injections. In this case, we'll use culture-expanded stem cells. And where the pain is located and what's causing the pain are often two very different things. So we have to always remember that there's often a disconnect between what the problem is and where it hurts. So have a great day, and thanks for watching.